Yeah, you can start it, Amrit.
Uh, Good evening, everyone. So today we'll walk through a very important step in research, that is basically moving from the existing literature that I have discussed yesterday to framing our own research questions. It's like how you put research questions in front of people. It's like how are you actually finding out those gaps in the research paper, how to exactly to read out your articles or journals. So I'll be discussing that with you today. And along with that, what we often researchers struggle is that not because that they lack the ideas, but because they, actually don't know how to identify uh, with the gap in already existing knowledge. So in this session, we'll practice like how to exactly, recognize those gaps and convert it into a strong and feasible research question. So when we read basically a research paper, what is the first thing we usually look at? Is it the abstract? Is it the introduction, or is it the conclusion? So it's basically should finding the gaps. It's finding the opportunities for to become a impactful research. So today's agenda will be critical thinking at first. It's like how to read, how to, develop a systematic approach towards scientific literature, and how to read the whole structure, anatomy, how to understand those anatomy of abstracts, like how to deconstruct it, and then finding those gaps which are, unexplored in that research article, and then formulation questions. It's like turning gaps into research opportunities for your upcoming researcher project. And at the end, I'll be discussing a case study of NEEM through which we'll be applying techniques to how to find out the gaps and how to exactly read, and to basically move towards your research purpose. So now, what is the like why it is so important to find research gaps? First of all, it's like it gives us like the original contributions, advanced knowledge. It's like this is the very fundamental goal of research. We are here not just here to rewrite or to what others have said. Our job is to add a new piece of a puzzle, you can say, or discover something new connection out of challenge and existing which is already present in the like hub in the website, to challenge that. This is how the fields evolve and how we can make it, we can make progress. So this pushes the field forward by adding new knowledge, and also it helps in avoiding the redundancies, like preventing us from wasting time on research that has already been like it's done already. So how to avoid those like and moving forward with the help of time management, and then increasing funding as well. It's like makes our project more how our project can be more appealing to grant committees, looking for innovative ideas as well, and enhancing academic reputation. It's like establishing you as a thought leader, or you can say an expert in that field, and drives career advancements. Like it also helps in opening the doors to new knowledge, new opportunities, can say, for like your professional recognition as well. So part one, the first part is critical reading of scientific literature. So what it actually means, that critical reading, it's like it's a process of actively analyzing and to evaluate a scientific paper. It might be in a paper, article, or journal, rather than passively accepting everything it says. It's like you have to critically read, you have to critically understand. It's like without like thoroughly, if like if you want to read it thoroughly, how critically you are actually accepting that thing. It's like instead of asking what does that paper say, so you can ask like, is it like really reliable to me, is it like valid to me, or is it relevant to my choice of interest? So this is how it actually works. So there are like key aspects, many key aspects of critical reading as well. So first can be the, assessing the research question, or evaluating those methods, or interpreting the results, and many more. So next is there are like different literature landscape, as we all know. First is primary literature, second is secondary, and the third one is preprints that I have, yesterday given a introduction about the gray literature. It comes under that. Primary literature, it is like the original research, we can say, the first publications of any new data, or you can say any new research articles or lab studies or any clinical trials surveys with like new results. Uh, Secondary literature, it includes the analysis part. It's like multiple studies. It's like the interpretation or the summary. We can say it is a small summary of whatever is like there in the primary literature. So they are interlinked. It's like review articles, systematic reviews, or meta-analysis also in the secondary literature. Third is preprints. It's like, as we all know, like these are the non-peer reviewed preliminary findings through which we can actually explore many things. We can find out the negative results as well. We can question out, like we can explore more into that. And then comes like the strategic versus what we can say passive reading. It's like there are two types of reader, as we know. It's like passive reader is they will read like linearly. It's like from they will not go thoroughly or that from start to finish. They'll just it just their mind comes with like, I just have to read it and I just have to finish it very fastly without any patience. So they will just do that. And it's like they will accept claims at the face value and misses those underlying assumptions. Because they are reading it, they are not reading it thoroughly, and they are like, I just have to finish it. If you want to finish it quickly, you will like miss many things which are like actually important to you, important and like regarding to your what to say, like your research and all. And then overlooking those methodology limitations, you will you won't be able to find out those methods. Strategic readers are those readers that will read with specific questions. It's like whatever you are reading, might it be an abstract, might it be an introduction, it's like whatever you are going through it, you have to find out your type of questions, and also you are the one who will be answering that, and you have to find out that are you getting that particular answer in that particular phase or not. It also helps in evaluating evidence critically, and identifies they also identify assumptions and limitations as well, connects findings to the broader context. It's like whatever your research choice of interest would be, they like this type of readers will just go through into a very broader context to make them to make their research to attend a very high quality. So this is a method of what we say that SQ3R reading method. S stands for survey. It's like scheme title, abstract or headings, figures, whatever there are present in the articles. You need to go through this. And the question, formulate questions about the contents, like formulate question by yourself. Like, are you exactly getting what you actually want, or are other authors have actually put all the interpretations correct or not? And then read it, active reading. What we say, it's like for answers to questions, like are you finding out exactly those answers, are you getting those hypotheses or assumptions that they have put? So there are like a lot of things. And then comes the recite. It's like summarizing the key points in your own words. You can summarize those key points, and then review at the end. It's like to connect those existing knowledge and identifying gaps to fulfill your research. Then comes the strategic reading question. It's like you have to ask, like, what is the central research question is about, like what exactly they are trying to find out and what exactly they are providing, and then what methods are basically used and why particularly that method is being used, why not the alternative one. You have to find those questions out. And then what are the key findings in that paper? It's like what are the limitations? Every paper might have one or two limitations, so you have to go through that properly to find out those limitations, those challenges, to acknowledge the study, and what questions that you are actually making in your mind, what questions are that are remained unanswered, so that you have to find out more and you have to explore more with in your choice of field. And then comes, it's like reading between the lines. It's like make a habit of reading between the lines. It's like looking for hedging language. It's like phrases that include may or suggest. This often signals that the authors are being cautious. It's like the language is important because it indicates the findings that are not definitive or like definitive conclusions. So for example, a study might say a new drug may reduce, may or might be, it suggests that may reduce any symptoms, meaning that the evidence is not that much strong enough for them to exactly claim that it is actually, absolutely it does, that absolutely it might, reduce those symptoms. Then comes unstated assumptions. It's like pay attention to the unwritten rules or any ideas of the authors that are operating on. This can be a very crucial part to validate those conclusions at the end. And then comes the sample size and power issues. It's like a very small sample size can make it difficult to draw, reliable conclusion. So for example, it's like if you're going with a statistical power, or if you're referring any statistical tools, it's like to the likelihood that a study will detect an effect, like when one truly exists. So this might be helpful for you in the future aspect of your research. And then correlation with the presented as like causation. It's like just because two things are happening together doesn't mean that one cause the other. It's not like it might not be that much interrelated. It's like these two causes are interrelated or not, you have to find out in that. It's like this is, for example, like one variable that directly causes a change in another, whether it is having or not. And then question to ask yourself, it's like in through the go through the data interpretation, what might be the alternatives. It's like, are there any other ways to explain the data beside the one that has already been provided by the author? So you have to go through that. And then generalizability of findings. It's like, can the results of this study be applied to a like broader population or a very big population, or any different situations. So like may not be, might not be generalizable to the elderly, for example. Some might be generalizable to only children, or aged people. So one of them might get missed out, so you have to find out that. And then contradictions with other literature. It's like, does this proper like does this exactly that paper agree with or contradicting with other research in the field? You have to also check into that. Is if it contradicts establishing findings, like is there a compelling reason provided to it? So you have to find out. And then the like what the authors aren't saying, you have to note that things. Like this is the most crucial part of reading between the lines, as I would say, because what information has been left out, like are there any limitations or any contradictions that haven't been discussed in the paper? So the most important insights often come from what is unsaid or what is minimized. So you have to go through those important things. So the next part is like anatomy of abstract. It's like to thoroughly read, to thoroughly understand the part of abstract by deconstructing the research summaries. So it's like, then it's like, why focus on abstract? So it's like key reasons to focus on abstracts are like first is concentrated information. It's like abstract will provide a compact summary. It is a compact summary of an article. It will not provide you the entire paper. So it is just a summary. So that includes, we all know, background, methods, results, conclusion. So what this allow is to quickly grasp those knowledge or core of the research without reading the full text. So next comes the standardized format. That is, most journals that require abstracts to follow a specific structure. It's like they've basically not all journals go with the one flow or go have one regulations or rules. They might have different rules as well. Basically, like introduction, methods, results, and discussion is used, which makes people easier to compare different papers. And the next is explicit gap statements. That is, authors often clearly state that this research gap they are addressing within the abstract. So you have to go through it. They directly, some author directly say, some author might not, like mention that in the abstract, but you need to go through that properly. So this, helps to determine if the paper is relevant to your own work or not. So this is very important. The next is efficient literature scanning. It's like by focusing on abstract, you can rapidly review a large number of papers. Like this is an, skill for conducting a literature review, and also it will help you in time management, as I say. The last is reveals, research framing. It's like the abstract that shows how the authors actually present their work and what they emphasize as their key contributions in that. So you have to find out, this gives you the insight into the paper's main argument, and also how it fits into that broader field, if it's fitting into that broader field, or if it's like, are you finding out that essential in your part. So yeah, this is all of this, like points are very essential to be noted, that why do we have to focus on abstract at the very first. Then comes, like typical abstract structure. As we all know, it has background. It's like what it like a small definition or something, or in 2 to 3 lines you have to complete like what you exactly want, what you have exactly done in that literature. That will be the background. The problem will be there, the problem will be mentioned or might not be mentioned, you have to solve it. So what remains unknown or unresolved, you have to find out. The methods and approaches, the methodology that they have used, like how the researchers actually address those gaps, you have to find out. And then comes the results, like the key findings from the investigation. It's like the whatever they have done, whatever they have interpreted, like what exactly they are trying to find out. All of them will be broadly like expected in the results. And then comes the conclusion and implications, where the findings like what exactly the findings mean for the field. So basically, in the conclusion only, you will find certain gaps. It's like what they are actually hypothesizing, what they are assuming, and what they are not assuming, and what they are like they are not sure of that assumption. So you can find basically normal gaps or research gaps in conclusion if you'll read thoroughly with that. Then comes the abstract deconstruction. So it is abstract deconstruction. It means that, breaking down that particular scientific or any abstract into its key components. So it's like to understand what the study is about, how it has done, why it was found out, why they have perform that methods, or like why does it matters. So instead of reading the abstract as one text, you can dissect it. It's like you can make it part by part, section by section, and you can read it. So, and also, as we all know, as I have mentioned, that typical parts of scientific abstract are like background, its aim, like what are the aiming of the methods, results, and conclusion. And then comes, it's like the linguistic markers of research gaps. It's like explicit gap statements, like despite extensive research, a little is known about. So this type of sentence will, should have, there might be some answer to that. There, if there is no answer, then it can be called as the gap. It's like it remains unclear whether, if they're using whether, or it's like they're saying, if they're mentioning unclear, that means there is certain gaps in that. And then limitation acknowledgements, like previous studies have been limited by, like that, a major challenge has been seen. So this is the limitation acknowledgements. And questioning and hypothesizing, so what they are exactly raising the question of about, and what they are hypothesizing is like whether they're hypothesizing, whatever they're hypothesizing, is it like going with the research, going with the article or not. You have to find out by reading thoroughly. And then decoding what is known to you. It's like look for consensus, like statements. It's like consent statements, or references that are established to be finding, or it's like, you know what is known. It's like there are statements, there might be statements that summarize the current state of the knowledge or existing research. So they provide the background and context for the study. So an abstract might start with this to, establish the main importance of the research topic. And then, research gaps that we say, how to critically analyze that is this, it's like the it is the most crucial part of the abstract. It's like justifies the need for the new study. It's like, however, little is known or about or previously or whether, these types of, like words can be assessed as the research gap. So and then comes, it's like the present tense descriptions. It's like multiple citation support as well. So you have to first decode what is already known, and then is what is missing in that. It's like look for the words that I have just now mentioned. It's like however or yet, but yet or but, or like there are like previously research has not addressed, or whether, like that. So you have to find out what is known to you and what is missing to you, and you have to correlate, and you have to question yourself from that literature, and you have to find out those answers. And if you're not finding those answers, and if like it is unanswerable, then you have to go through more, you have to explore more, and broaden your research so that you can find those gaps. Then comes the, like abstract analysis exercise. It is one of the like most important analysis, as we can say. It's like, you have to, like the core of the exercise, it's like it has to be taken under like recent abstract that I'm talking about, like your field, and it breaks into three specific parts. So for, it's like three statements representing what is known. What is known is like that I have said already. It's like, summarizing the current state of knowledge. And then two statements that indicates your research gaps. It's like the statements that highlight what is missing from that particular existing literature. And this is the very crucial part of, analyzing abstract, that is research gaps, that is finding out the, the crucial part of the abstract, as it justifies the need for a new study or a new research. So and then comes like one potential research question that is not addressed. Like this point requires you to read between the lines. It's like it asks you to teach, it's like think about what the authors could have actually investigated but chose not to address that. It's like this helps you find out critically to, about the scope and also the limitations of the study. So this can help you generate new ideas for your own research as well. So apply this condition whenever you are, reading or going through an abstract. The next is finding the gap. So as I said, it is the most important part. So it's like the systematic approach to identifying the unexplored territory. It's like what is unexplored yet in that particular article, you should find out. And there are different types of research gaps, that are knowledge gaps. It's like missing information. There will be like many articles which you will find like this information is missing, so you can just point it out and you can just, search it more, do that things. And methodological gaps, there might be any gaps or limitations in those in normal methods that they have used. Those theoretical gaps might be there. It's like the inadequate explanatory frameworks. And those population gaps as well. It's like a small quantity, a small amount of like population has been studied, only others are being excluded. Why it has been excluded, so you can just explore it more. So the next is the gap finding metrics. So it's like, it is organized, as we say, it is organized into three columns. It's like the first is gap type. So gap type, the first is knowledge gap. So this occurs when there is lack of information, on that particular topic. The markers will be like little is known about, or the effect of X on Y have not been fully explored. So what is the opportunity there? How can you find out those gaps? It's like this gap basically presents an opportunity for the exploratory research. It's like you can find out, you can explore more. So where the goal is to investigate a new area or topic. Then comes the method gap. It's like this exists when previous studies have used inadequate or outdated methods to study a topic. The markers will be like, look for phrases such as like previous studies relied on, or the methods used in earlier research had limitations. So this will come under novel approaches or a new invention of a methodology to get a better answer to an existing question. Then comes the theory gap. Theory gap, it's like the gap occurs when already existing theories or models are insufficient to explain a phenomenon. It's like the presence of phrases like current models fails to explain, or it might be the any theory that cannot account for this particular new observation. So this will invite to engage you in the like framework development, where the goal or the main motive will be to create new theories as well, or to refine those existing knowledge, or to make that better, to better explain a phenomenon. The last is population gap. It's like this refers to the lack of research on a specific group of people. It's like a phrase such as limited studies has been done, or the research has primarily focused on that particular group only. So this will, this will have the chance for the targeted investigation. It's like that focus specifically on a understudied population, you can say. Then comes like the gap finding through systematic reviews. It's like mapping the territory of existing research. It's like systematic reviews that starts by creating, comprehensive map of all the relevant studies on that particular topic. So this might help you in finding out to see in the bigger picture, like to identify where that field is well researched and where it is not. Next comes is identifying inconsistent finding. It's like when different studies on the same topic have been conflicting, have are being given with conflicting results. So it's like it will be a strong sign of a research gap. Next is the stop methodological limitations. It's like a systematic review that basically can highlight common flaws or weakness in that methods, that is been used across multiple studies. So this might also you know helpful in finding gaps as well. Next comes is recognize understudied populations, that I have said earlier also. It's like by reviewing a large population, you can like large work, you can easily see if certain groups or populations have been neglected in the research. So this might be your point to explore more into that particular population, as you can say. And then the last is discovering questions explicitly noted as future work. It's like many research papers that conclude by only suggesting areas for future research. So systematic reviews are the excellent way, I would say, to compile this all suggestions and identify those themes or questions that have not yet been addressed yet. So these are really very good opportunity for researchers to find those gaps out and to explore more. So the next is gap finding through citation analysis. So it's like I would say, like example, I'll give an example. It's like think a research like a family tree. So backward citation will be your, the older work that influence the study, that you can say like from a family tree, those are the ancestors, you can say. And the forward citations will be your descendants. It's like the newer study that will be done, or that is built upon that is built upon to the existing literature. So forward citation, it's like it depicts like who cited this paper letter. It's like it helps tracking new trends. It helps you shows how the field is actually evolving. The backward citation includes, it's like which paper did this one cite. It's like it helps you identify those theories or methods that are actually involved, and some of them is like shows if some important work is missing out in that particular thing. And why it is useful, this like analysis, it's like it's help. First of all, definitely it will help you find out those research gaps, and also it will avoid repeating what has been already done. By comparing with the forward with backward, you can find out those, and you can add to your new contributions. So basically tools for this can be used as Google Scholar, Web of Science, Scopus, or any connected papers. So next is like gap finding in contradiction. So it's like for example, it's like identifying conflicting results. It's like look for studies with like different or opposite conclusions. It's like for example, one study finds a drug is effective, another says it doesn't work. So this is how the result is conflicted. The second is analyze those potential causes. It's like why might they disagree? It's like different methods or any animal methods or any clinical trial or different populations, like age. It might be related to any age or gender, or race. It's like so different sample size or controls, and there might also be contradictions, so you can find out with the help of that or too. Then formulate reconciliation hypothesis, like try to explain the contradiction, try to find out. It's like maybe the for example, maybe the drug only works in younger patients. That's like a very questionable new hypothesis, you can say, or testable new hypothesis, you can tell. So next comes is like gap finding in methodological limitation. It's like a very small sample size has been studied, like why it has been studied only that particular sample, very limited diversity in study population, or there might be any like discrepancies in vitro versus in vivo results, short term versus long term effects might be seen. It's like surrogate endpoints versus clinical outcomes. It's like there might be issues with that. Then is it correlating, or is it like giving a casual evidence or the proper evidence? So you might find many gap findings in methodological limitations as well. Then comes it's like the hypothesis driven gap finding. It's like it explains a strategy, like instead of just looking for what's missing, you can just approach uses as an existing finding or hypothesis as a starting point to generate like new research questions. It's like if x causes a y, it's like this is the most basic cause and effect relationship, as we say. To find a gap, we just don't accept the finding, instead we question the details and context. So here it comes like if x causes y, then what actually causes x. So then what mediates this relationship? So this, whether it is like asking about the how, or like intermediating steps and all. And then comes in which context, like does this actually vary. It's like this focuses on the conditions. Then comes if mechanism A explains. It's like for example, are there any parallel mechanisms? Like this question prompts you to look for other as well, other aspects as well, like possibly unknown ways, like the same outcome could be achieved. Then comes what regulates these mechanisms. Like this asks about the control factors, as you can see, like what turns this mechanism like on or off, like what influences its strength towards that. Then comes like how does it interact with mechanism B. It's like this encourage, what it does is like it helps you to encourage a level view, like how to like considering how multiple processes might work together, how multiple mechanisms might work together. The last is if population P shows. It's like what about related populations. Like if a finding is true for one group, is it also true for a similar one? You have to find out that thing. And then what about extremes or outliers. Like these questions like pushes you to examine the boundaries like they have set up in a finding. It's like does this relationship hold for those who are actually very different from the average. So that might also will be a questionable thing. Then it's like what about over longer time frames. It's like this adds a dimension where like does the finding change or it reverse over time. It's like uh, according to the time, is it like changing or not, or is it in the same place or sticking to that same point. So these are all the findings that you can do by applying the hypothesis driven gap finding. So the next is it's like the so what test. So it's like, as we know, not all like all of this like gaps are worth filling. It's like you have to ask yourself, why does this gap actually exist? Is like, is it really worthy of having that gap issues, research gap? It's like, what would change if we knew this? Like, what might be the changes that will come in front of you if you already had known about that thing? It's like, who would be benefited from this particular knowledge? Is it only a particular population, or is it like a whole community, or is like a whole, about the society? How does this connect to a bigger question? It's like, how can we connect this to a bigger question, or to see something, in an extended, in an extended world? So the next part four is like formulating research questions. It's like, how are you how are you going to do that formulation of research questions? So the anatomy for a good research question, it starts with like focused at first. Focus is like, it is narrow and specific. It's not too much broad. It's like, for example, I would give, how does a compound X affect the pathway Y in cell type Z? So this should be your prompt, not like what are the effects of compound X. It's like, just make it specific. Just what exactly do you want? If you will put what are the effects of a lot of information gonna come, so it might not be impactful. All the information might not be impactful to you. So exactly what you want to grab, what you want to extract from that particular article. So just put that prompt into that. Then comes the feasibility. It's like answerable with current methods or datas and resources. For example, like, can this biomarker X predict response to therapy Y? It's like, this will be the correct prompt. The next is, what is the complete molecular basis of consciousness? This is like, it's not possible that much to answer that particular aspect if you're prompting this sentence. So better to be feasible, better to be like answerable. It should be answerable with the methods, datas as well. And then novel, it's like adding something new to the field. It's like, how do factors A and B interact in process with the C? It's like, does X cause Y? It's like, it will be already known to you. So find something novel to that. I like, use prompt that will bring novelty to your research as well. And then last comes the significant. It's like, the answer should matter to the scientific community or the society. It's like, for example, how does mechanism X contribute to disease Y progression? If you'll search what is the 17th protein in pathway Z, this will, give you, this will have a low impact of that whole research. So find more way to, do a good research by questioning at a very good point and specific point, with maintaining the feasibility and novelty. And you need to be significant, of course. The next comes the finer framework. The F stands for feasible, I stands for interesting, N stands for novel, and and E stands for ethical, and relevance stands for, and R stands for relevancy. So it's like, feasibility is like, do you really have the resources or skills or time and participants to do the study? And for example, like a small lab that may not attempt a full genome sequencing project. So it might be a feasibility question. And then comes interesting. It's like, the question should matter to you and the society. Novel, it's like, that I have mentioned already. It's like, does it bringing anything new to you, new knowledge or a fresh perspective on your study? It's like ethical. You need to be ethical. It's like, it can be conducted responsibly without, doing any harmful react with humans. It's like, clinical ethics or animal ethics or the environment. So, and also at the end, it's relevant. So does it continue to the science and society? Like, is it exactly relevant to the knowledge and society? So you need to like, be prepared and keep that in your mind, this finer framework, whenever you are searching for some good question or searching for some good research. Then comes the, it's like, from gap to question. It's like a process. So it's like, it illustrates, it's like the process of turning a broad research gap into a hypothesis. So first is like, the process begins with a broad, it's like identifying the gap. It's like, this is the starting point. As we can see, it's a general statement that tells us about what's missing in the existing like research. And then formulating a broad question. It's like once the gap is identified, you turning it into a question, and then creating a narrow question. It's like this steps requires you to focus on a particular specific aspect of that broad question. The next is testable hypothesis. It's like the final step is to turn the like narrow question into a testable hypothesis. Like this is a precise statement that will help you in predicting the outcome of the like experiment. Then comes the research questions type. It's like descriptive will be like what is exactly happening. It's like just describing facts or frequencies. Then comes the correlation. It's like how are things actually related. It's like looks at associations between two factors, but that does not actually prove you the cause effect. And then comes the explanatory. It's like why does it happens? What is the reason behind that? It's like go deeper into the mechanisms, try to understand the causes that might cause. And then the interventional. It's like what if we change something? What if we add something extra? What if we do something novel? It's like test if any action or any treatment changes that particular outcome. And then this is like the yesterday also I have given one talk about this framework as well. It's like the PICO framework or PEO. It's like observational. PEO is observational. It's like you will find out the population or the problem, you will find out the exposure, and you'll find out the outcome. It's like in a population, what is the relationship between that exposure and outcome? You have to find out that. And in interventional, it's like in that particular population, how does an intervention compare to that of any comparison it might be? Like yesterday, we have used example of anxiety. Like if the standardized medications are good, if we compare to that of placebo treatments, how is it affecting? Is it reducing the anxiety? So this how you need to put those like your thoughts into this framework and find out exactly what you want from that. So the next is like finding out like from very like casual to precise. It's like for example, two if you search on too broad, it's like how do plants respond to stress? It's like a too broad thing. If you want to do more specific, it's like how do crop plants respond to drought? It's like you are mentioning the type of population or anything. Population, it's like for example a crop plant or any sort of any sort of things that you are putting it, and you are responding it to particular disease. And well focused will be like how does ABA signaling in maize roots change during moderate drought? It's like you are putting that particular mechanism also, you are finding out or trying to finding out how that mechanism actually act in that roots that might change during your moderate drought. So this is how you should be searching terms from being too broad to precision. So next comes the common pitfalls that we do in question formulation. So it's like the kitchen sink. So what it actually tells is like it refers to trying to address too many variables or questions at once. It's like a kitchen sink. It's like question is overly broad and it lacks basically focus. So you have to make it impossible to answer within a single study. The next is the fishing expedition. It's like this is a mistake of collecting data without a clear question or any hypothesis or assumption. So the next is the solved problem. This pitfall it's actually involves the investigating a problem that is already well established or answered. So if there is already in the website, if there is already in the article, then why do we need to waste our time management and do that? That has already been done. So avoiding that thing might help in time management. And that impossible dream, it's like the pitfall is about asking questions that require resources or methods beyond your reach. It's like this could involve might be a lack of some consumption, any funding, or you might be saying any sort of like many specialized equipments that you don't right now, you don't have any access to. So, or a question that is simply too vast, or you have to answer you have to answer that like given current technology or knowledge. So these are the like four pitfalls that people basically do, then researchers basically do when you are formulating a question. The next part is that is the last part is the case study in the like neem in inflammation. So this is a case study. Let us study this case study once. So as we all know, neem, it is a traditional medicine plant. It is native to Indian subcontinent, and it is basically used for centuries in Ayurveda and traditional medicine. And then it contains more than 140 of bioactive compounds. It is also known for anti-inflammatory, antibiotic properties, and also antimicrobial properties. So it's like what we what is the basic concept context is like inflammation. So as we all know, inflammation are of two types, that is acute inflammation and chronic inflammation. Acute inflammation, it is the protective response to injury or an infection. Chronic inflammation, it will be the persistent inflammatory state that is associated with the numerous disease or dysregulated immune responses. Then the what are the cellular mediators that play important role in inflammatory cascade? There are cytokinins and enzymes COX-2 or like COX-1. Then this is a abstract analysis for example one. It's like what is written here. It's like neem has been used in traditional medicine for centuries due to its due to its medicinal properties. However, the molecular mechanisms underlying its anti-inflammatory effects remain incompletely understood. So what is there, written in that yellow mark, it will give you an idea of research gap. They are written, see the words, focus on the words. It's written however, and it is written incompletely. These are the two negative words that are coming from that abstract. So you can just note it down, you can just write it down, like what are the negative like words that are actually present in that particular abstract, so that it will be easy to you for you to explore more into that. So then comes like the results showed significant reduction in TNF alpha. It's like the result showing this, but it has no for it's like incomplete. It's showing like incomplete. It doesn't have that much of mark. Like what exactly are you trying to prove in that particular abstract? So in this, what is known, we have to find out again about neem. It's like it is traditionally used for inflammatory condition. We all know that it contains more than numerous bioactive compounds. We know that as well. It's like how it is demonstrated in anti-inflammatory effects. Like there are various in vitro and animal models that are being run, that have been run, and then some cellular targets also they have been identified. So these things are all known about neem. Next comes the example 2. Neem-derived compounds have shown anti-inflammatory properties in multiple experimental models. While several studies have examined effects on like cytokine production, the impact on specific signaling pathways and long-term inflammatory resolution remains unclear. It means like although there are several studies that has been examined to provide the effects on cytokine production, but there are certain specific signal pathways which are being yet unclear to, like they have not explored yet, they have not studied. So they have written, we have evaluated curable nimbolide in like chronic colitis models over 8 weeks. So treatment reduced histological inflammation scores by 62% and decrease NFKB activation. It's like in here multiple signaling pathways have not yet been resolved, or they have not studied yet. So they have only gone through with the cytokine production. There might be other signaling pathways also that might cause inflammation. What are the other signaling pathways? So this question should come in your mind whenever you are reading this type of abstract. You have to note it down and you have to find your answers like whenever you are exploring more in that field. This is the example 3. It's like inflammation plays a crucial role in numerous chronic disease, and plant-derived compounds offer promising therapeutic potential. While neem extracts have demonstrated anti-inflammatory effects in acute models, their efficacy in chronic inflammatory conditions and comparative potency against standard treatments remains poorly characterized. It means like neem has activity with anti-inflammatory, but it has only shown effects in acute models. For chronic inflammatory conditions, they have not proved any treatments that actually make that point very strong. So this then it comes like this systematic review synthesize evidence from 32 studies, and it goes on. So those yellow marked words or sentences that I have shown and I have read. So you can find a lot of gaps in that. You can find a lot of questions in that. So whenever you are going through such abstract, you need to find out those gaps, like what exactly are they trying to prove and what exactly are they like showing to us and what they have not done. So these things you should keep in mind whenever you are finding a research gap. So the next is identifying gaps in research. So it's like it might be mechanistic gaps as well. It's like the in the first is like incomplete understanding of cellular pathways. It's like molecular targets have not yet been. It's like there are many unknown molecular targets that are not yet been done with the research. Next comes the pharmacological gaps. That is, the dose response relationships are unclear. What is the bioavailability or metabolism? As they have mentioned that it is poorly categorized for long term chronic inflammation. So what about that? Then comes the clinical gaps. There are many limited clinical trials that has been approached with the neem research, and unclear efficacy compared to any standard treatments. So this is how it basically you have to find out in which particular area the gaps are being found, and how you are questioning yourself and finding out those unanswered attempts. So these are the gap metrics for neem research. So it's like there are basically four types of gap matrix that has been shown here. So for example, it's specific compounds. So the status is partial. It's like the specific, they have mentioned only two or three specific compounds. So what you can do here is you can isolate and test individual bioactive compounds that are present in neem. Then signaling pathways, those are also fine. Like they have not targeted multiple targets pathways, they have only shown the limited. So here you can map those effect on map all those signaling pathways that have effect on inflammatory cascade. Then comes the chronic models, that is very limited. Like long term or chronic inflammatory disease models have not yet been mostly done. So you can focus on that too. It's like the clinical evidence, like almost no it is. So design a control clinical trial. So you that might help you find out the answers with that particular population as well. So it's like that I have said the areas in yellow represent significant knowledge gaps. So from that yellow statement that I have stated right now, this will give a deep visualization of the gap, the research gap that you were trying to find out in that particular article. So then comes the from gaps to questions. So it's like first is mechanistic questions, like how does nimbolite modulate the NFKB pathway in specific cell type? It's like which which neem compounds target this particular protein, or because here they have only given in a specific cell type, so they have not discovered other than any other pathways that might be influential in that particular research. There will be a comparative question as well, like how does purified neem can be compared to standard NSAIDs. It's like you can search in models too. It's like what are the difference, how it can be competitive with those that are marketed with the marketed products. So which neem fraction actually provides the anti-inflammatory activity? You need to find out like if they have actually provided those, fraction. It's like exactly which fraction, on which fraction it is actually giving the activity. And then comes the translational questions like, can standardized neem extract actually reduce inflammatory biomarkers in patients with disease, for example rheumatoid arthritis? So is it helping in that? You have to find out. Then what is the safety profile, what is the safety pharmacokinetics or the bioavailability of that particular drug for long term needs supplementation, like whether there will be any adverse effects or what might be the changes that the physiological like we can see physiologically. So the next is the PICO framework like application that I have already mentioned, that population comparison. Always try to apply this framework whenever you are trying to search something. It's like, for example, in patients with rheumatoid arthritis on standard therapy, does supplementation with standardized neem extract with this mg compared to placebo actually reduce disease activity and inflammatory biomarkers over 12 weeks? So here the population is the patients that are being diagnosed with rheumatoid arthritis on standard therapy. The comparison is done with a placebo supplement. The intervention is the standardized neem extract, that is 300 mg daily. Outcome is to change in the activity score and inflammatory biomarkers at 12 weeks in the patient like who are being who are being involved in rheumatoid arthritis. So this will help you in actually finding out the main cause, the population, also the intervention also, and what exactly are they trying to provide, or what exactly they are trying to prove to you. So then comes the finer criteria. So it's like the finer criteria, it actually tells you with the five criteria. It's like feasible, interesting, noble, ethical, and relevant. Feasibility is like a research that is, question, the research question that is feasible if you can realistically answer it with the resources you have, like all the resources. Interesting is like the question should be engaging to you, the researcher, as well as to the wider specific community, so it should be engaging. The novelty is like if the research question should address a gap in existing knowledge, it shouldn't be a solved problem, it should be a new something. It's like example of a first control trial in rheumatoid arthritis patients you can use. So like that. And then comes the ethical. It's like your research must be conducted in a way so that you respect all the rights and regulations under the welfare of participants. So this is very important. Then the next is like relevancy. It's like the question should have a practical or theoretical impact to you as well as to the society. So you have to think that wise too. So the next is like beyond neem, is like the whatever I have like discussed in the previous slides. So all of them are being accumulated here. It's like apply those principles that are specific to your research area. Identify what is known to you and decode it. What is known to you and what is not known to you. It's like what is unclear. Formulate precise, like answerable. Use PICO framework, use finer criteria. It's like refine based on the availability of resources and expertise. So the last part is like the gap finding exercise. So the first abstract deconstruction that I have already told you is like selecting three recent papers in your field, highlighting the abstract sections, and then extract those gap statements which are identified as unknown, which they have not given you with the ultimate proof. It's like identify implicit gaps as well. The next is citation network analysis. It's like choosing the particular seminal paper in, like if you find out, or like identifying papers that has been cited in the last 2 years. You can find out and analyze how different researchers have built on with that particular citations, then map those unexplored directions and applications in that particular research, and formulate 2 to 3 novel research questions to find something, like add up to the existing knowledge of that particular research. Then comes the contradictions and controversies. It's like for example, it's like first step one is like identifying a controversial topic or conflicting findings in your field. It's like if there are any contradictions that are coming, and then create a table that summarize your whatever you are putting the questions, are this opposing your positions or evidence. Then analyze those methods that are different, that will put differences, that might explain contradictions, and then formulate research questions that could actually resolve or clarify the debate like that is going on in like type of time of questioning and answering. The next is the next exercise is methodological gap analysis that I have mentioned earlier. It's like identifying those common methods in your field. What are the methods actually involved? It's like least those limitations that are present in that. And like research emerging methods is like what new technology or approaches can be developed in that particular field. Formulate methodological innovation questions like how can you approach those overcome current limitations, how can you overcome those limitations with the help of your research. The next is what's missing. It's like the exercise 5. It's like what's missing in that. It's like what mechanisms explain this, in what context does this not apply. Like at first you will see what it is applying and what it's not applying with. It's like what comes before and after this, what will come after that, and like how could this be applied differently in different, is there any scope of using this in different field as well. So you need to go through that as well. And then is like peer question critic. It's like form a small group of 3 or 4 peers with your friends, and then in each person bring 1 to 2 draft research questions among yourself, discuss it, evaluate it, use that final criteria pico framework. With that, provide specific improvement suggestions, and then refine questions that are like based on feedbacks. So it's like evaluation question might be like, is the gap clearly addressed? Has it been addressed yet? Or like, is the scope appropriate? It's like, are variables, those variables are well defined? Is the methodology literally really feasible with that research? Like, does it make a meaningful contribution to your research? So then next is the resources and next steps, like the additional tools. Research gaps, database. Basically, there are like 3 types. It's like systematic review database. It's like these are special database that don't just contain individual papers, but it also will give you the entire systematic reviews as well. It's like citation analysis tools like Scopus, Web of Science. These are very powerful, for more than just finding papers. It's like they will allow you to see the difference, the relationships between different studies as well. And the next one is the research mapping software. It's like this category is the advanced visual analysis, as we say. It's like this maps show the clusters of highly cited papers or populated topics, or any connections between different concepts that you might need to that will like cross over your mind, or you might want to discover that further. These are some of the like recommended readings that you can find out, and you can go through this for the better understanding and how to exactly design clinical research, and how it's like how you can design your own research, and how qualitatively and quantitatively you can put together your questions, and you will be able to answer. So these are the key takeaways from all the these are the like concise summary that I have said detail in detail to the entire process. The first is read strategically. It's like the principle is directly supported by the why, focus on abstract and reading between the line slides that I have actually given you in that. The map the territory. It's like mapping the territory involves using a systematic or big picture approach, a broad approach to see whether the entire landscape of a research field is like conducted or not. Then comes the craft precise questions. So it emphasizes those importance of moving from a broad general idea to a focused and a very testable or specific hypothesis. Then apply frameworks, as I have repeatedly saying, use finer pico and other frameworks that will help you to refine your questions and to make you understand and also help you in evaluating your research as well. So next step is like selecting 3 to 5 recent papers in your specific research area. Apply the abstract deconstruction techniques that I have mentioned earlier. Identify at least one of the meaningful research gap from that particular research. Formulate, put that framework into your research question. Evaluate your question using the finer criteria as well. Share with your peers, your friends, and find out the feedbacks and refinement as well, by discussing the research paper as well. So with that, I have reached the end of our session. So I want to leave you with one final thought is like by embracing these principles, all of the principles, you are not just doing research. It's like you are building on the foundation of knowledge as well. It's like in a meaningful and also in an impactful way. So that's all about this session. Thank you for your time and engagement today. So over to you, sir. Thank you so much.
Thank you, Amrita. It was nice session. So with this 2 sessions, we actually discussed about different databases and how to actually go through the articles using different frameworks and develop your hypothesis. There are a couple of questions. So one of the question which Komal has asked is that instead of reading the complete research paper, can she just read the future direction or limitation and find out the research question?
Uh, no. For that, you have to read thoroughly the paper and, because your limitations can be hidden in an introduction, in a line of introduction also. It might be seen in methodology also. So you have to read thoroughly, to understand those gaps and to find out those limitations, because certain articles doesn't like openly, they don't say like, yes, I have this limitation in that, I have that. So for that you have they will put indirectly. So for that you have to go through, nicely, patiently with those papers.
Okay, thanks, Amrita. The next question is criteria to decide forward citation and backward citations. How many years gap in between we can say this is backward citation?
I would say, I would suggest not more than 5 to 7 years. So it's like from now you can check, like before 2018, like after 2018 or 2017. So 5 to 7 would be a perfect match to reframe that backward and forward citations.
Thanks. This is the last question from Harshal. So, what clues in a paper help me to see where more research is needed? So, basically, what should be read it so that way he can find out that there is a need for the research?
It's like you have to, first of all, you have to read it point wise. And it's like they some, as I said, some articles might not give you clues. It's like they will just thoroughly, I would say just s- look into the statements wherever it is written, like however or whether, or it's like, this from the above cited article we have done this. It's like you have to go through those articles also for to find out the gaps. It's like, for example, if they have referred a article in a particular method, so you have to go with that article as well, so to find out if there are, look, limitations in any methodology or any interpretation or result. So the more you explore, the more it's like it will not, you won't be able to find out it through by one article. So you have to find out more relevant articles that that are same to that particular like field. So yes, you have to go through more, like 1 to 2, or like basically for a day it's like 2 to 3 articles you have to read from that same basic interest to find out what exactly they're missing out.
Okay, thanks, Amrita. Thank you for for both the sessions which happen under the scientific writing. So we will continue the scientific writing sessions next week. So tomorrow we will be going to have session on clinical research by Dr. Sriharan. He will be talking about designing of the clinical trials, but more specifically, he will be focusing on designing the observational clinical trials. So, people who are interested in clinical trial, make sure that you join tomorrow's session. It will be at 7 p.m. only. Thanks. Thank you for joining.